Ya Allah, accept my salah. His
You're
love
listening to
puts
the
it
Mariam Kwata Show on Salam Media. It is 12:38 on this Tuesday. That means it is time for our Women's Health Tuesdays. Today we are talking about yeast infections, or also known as vaginal candy. I hate these medical terms. They're so difficult to pronounce. Vaginal candidiasis. I hope I was correct. To tell us more about this is our resident OBGYN, obstetrician and gynecologist, Dr. Tom Mokaya. Good afternoon, Dr. Tom.
Good afternoon to you, and good afternoon to your listeners.
How are you, Dr. Tom? Dr. Tom, can you hear me?
Hello. I can
Hi,
hear
can
you.
you
Yes,
hear
I
me?
can hear you.
All right, okay. So,
Yes, I
yeast
can hear you. Can you
infections.
hear me?
They are quite common, in fact, affecting about 3 out of 4 women. What exactly is it?
Now, a yeast infection is an infection which is caused by a yeast called Candida. And Candida is a fungus. So that's why people also say that I'm having a fungal infection. And they are the commonest is called Candida albicans. So that's why some people say I've got either Candida, I've got thrush, I've got a yeast infection, and it's
Okay.
a very common infection that is caused by Candida. Now, to tell you how common this infection is, this particular fungus is found in many parts of the body. It's found
Mm.
in the genital area, it's found in the skin, it's found in the mouth, it's found in the throat, and it's also found in the intestines. So, and it can be transmitted from any of those areas to the genital area.
Mm-hmm. Oh, and what are the symptoms of a yeast infection?
Now, the commonest symptoms of a yeast infection, the commonest symptom is itchiness around, when we're talking about vulvocandidiasis, that is around the vaginal area. The commonest presentation is itchiness around the vulva. Now, that is the commonest uh, complaint that most women complain of. The other complaint is that it's associated with a discharge, and that discharge is classically called, or it looks like cheese, so it's cottage cheese infection. And if one has been scratching that area for a long time, you may get excoriation of the skin. There might be, because of a lot of scratching, the area may also be able to be scratched and may form what looks like almost like a wound. And some people also say that every time they pass urine, it burns. So those are the commonest complaints of a yeast or a candida infection.
Mm-hmm. What common treatments are available for yeast infections?
Now, once, as you say, it is a very common infection, and most people do self medication. They go and buy yogurt and they take, because yogurt does change the flora in the vagina. And some people go and buy probiotics. So those are some of the common self-medication that people use. However, once the diagnosis has been confirmed, then it's important that one uses antifungal medication. And most people, I'm sure, are aware of an antifungal medication called either Canizole or Canex, which is a cream. So one can apply a local cream around where it is, which is an antifungal cream, or one can go and buy a tablet or medication that one swallows, so that it obviously goes into the bloodstream and finally finds itself into the genital area. So that the mainstay form of medical treatment that is available for candidiasis.
Mm-hmm. Yeah. Now, going back to the diagnosis, how is it diagnosed?
Now, the diagnosis is normally made according to stepwise, which we discussed before. One, there is the history taking. So the patient will present with those symptoms and signs that we've talked about before, and the healthcare professional will go ahead and do an examination. So when the examination is done, one will classically find cottage cheese, which cottage cheese looking like discharge, which is found around the vulvar area. And when one does a speculum, that is looking into the cervix and into the vagina, one will see a characteristic discharge, which looks like cottage cheese. And in instances where, so that most of the time makes the clinical diagnosis. And in instances where one is not sure, then we take a swab from, and once it's sent into the laboratory, it's looked under the microscope, and one is able to see a classic pattern which suggests that there is a fungal infection, something that we call hi-fi in microscopy. So the diagnosis can further be made either by looking at it microscopically. And in instances where we want to find out which specific fungus is there, then we do what is called as a fungal culture, where that discharge is taken and then it's grown in a particular medium, a particular growth medium where it grows, and then we can be able to decide, does it respond to the common antifungal or it requires a specialized antifungal treatment.
Mm-hmm. Can it become something else if left untreated?
Sorry, repeat that again.
A yeast infection, can it become something else?
Now, most of the time, in instances where the fungal infection is not treated, fortunately, most of them are the body can be able to fight those fungal infections. So it's not always that it must be treated. And unfortunately, a fungal infection will spontaneously resolve. However, in instances where we get chronic candidiasis, these patients will complain of what we call as vulvodynia, pain around the vulva, or very itchy around the vulva. So it could change into, and it can cause pain around the vulva. And once it causes pain around the vagina and the vulva, some women may find it difficult, or they have pain during sexual intercourse. So it can progress into what we call as dyspareunia, where one experiences pain during sexual intercourse. And if it continues, it can cause a lot of itchiness, and in some cases we find small little wounds or ulcers around that area. So if left untreated, and if the body does not treat it itself, it may evolve and lead into multiple complications.
Mm-hmm. All right, so thank you so much for sharing that information with us, Dr. Tom. And at-home remedies besides yogurt, what else can one do?
If I may go back a little bit, if one finds that the infection is recurrent, it's always good to go and see your practitioner, because there are some diseases which are associated with recurrent candida, like patients who have diabetes. And we tend to find it very common in pregnancy. Not that you're going to make a diagnosis of pregnancy based on an infection of candida. And some patients may actually be having an underlying cancer which has reduced their immunity, and therefore they develop candidiasis. So when one gets recurrent candidiasis, it is important that they go and have that properly investigated. Apart from the yogurt, there are many people. Some people, as I said, use just good plain yogurt, which is non-scented, or just general hygiene can be able to manage as a home remedy.
Mm-hmm. All right. Thank you so much for your time, Dr. Tom, and for sharing that information with us. I hope our listeners can take heed of the advice. Have a wonderful day.
Good. Thank you. Thank you very much for having me.
Right, that was Dr. Tom, our obstetrician and gynecologist, taking us through yeast infections or candidiasis. Yeah, vaginal candidiasis, which is a common infection. It affects up to 3 out of 4 women, and many women, of the 3 out of 4 women, will experience this at least twice in their lifetime. And probiotics do help, or just a simple cleanliness at home. And yogurt also, people will give you a host of things that you should do, but doctors knows best. If you have any further comments or questions for Dr. Tom, please leave them in the comment section or send them to our WhatsApp line on 061 766 0355. Don't go anywhere. We will be right back.